Indeed, Naledi, we are standing now at Red Cross War Memorial Children's Hospital. It's one of the oldest hospitals in South Africa. It was founded in 1956 through public subscriptions. When most people came through with donations to build this hospital, it was also established in memory of those soldiers that passed on the Second World War. So today, the Department of Health, together with the staff or the institution here at the Red Cross War Memorial, will launch a Child Protection Week to try and raise awareness on the importance of safeguarding the rights of children, their safety, and how they must be protected from neglect, abuse, violence, as well as all other forms of violations that occur to children. But I will be speaking to someone who's from the trust who also raises money for this hospital, Chantal Cooper, to just talk to us about some of the services that they render, some of the child protection services that they render for this hospital. Talk to us about the services that you render here, Chantal.
So the Red Cross Children's Hospital is a tertiary hospital, so it's a specialist hospital. So children who come through here are referred by various health facilities. But the children who come through our emergency unit, particularly children who've been identified as children who need specific child protection care, would be children who have experienced physical violence, sexual abuse, and then also a large element of child protection is neglect. And so part of Child Protection Week is we're raising awareness on the serious issues around the number of children who have experienced child protection issues, and violence is a very real part of their lives. But what we wanted to do as the Children's Hospital Trust is, how do we find a solution? So the Red Cross is really the end point for these children, because they are coming through the hospital because they are injured as a result of the abuse that they have experienced. And so the question is, how can we help support the hospital protect the children who've come in? And so one of the issues that came out is that child protection is a priority for the hospital. And so what the hospital wanted to do was strengthen the care provided for children who've been affected by violence. And one of the ways that we're doing that is supporting the hospital by creating a training program, so that when a child comes in and there's a red flag around, is that broken arm, did that child really fall off the bed, or is there evidence or a suspicion of abuse involved? It's more than just the obvious that you can see. It's like identifying children that's not obvious, is that ensuring that staff are trained to identify vulnerable children right at the beginning, so that children get the care and the interventions they need as quickly as possible.
You speak of vulnerable children. Where are they normally referred from, and also what cases do you normally receive? And also maybe if you can give us a context of the numbers, how many children are you taking care of, and also maybe for how long the duration?
So up until 2019, there was about 600 to 700 children that came through the hospital. And so there's different avenues of entry into the hospital. It could come through the emergency center. It could come through the outpatients department. You know, the cases are varied in terms of, you've had really serious forms of physical abuse where children have arms and legs broken, children thrown against the wall. You've had babies who've been raped so badly, toddlers who've been raped so badly that they need surgery. It's varied cases. But at the end of the day, it's our role at the health facility and the trust's role to support the staff to identify what help is needed and what to do next. So you have a child, you're worried, and you're like, I'm worried about this child. What is it that I need to do? Because it's not a simple process, because it's quite a complex. It's not just about health, it's about social justice, it's about the social services. And the project that we've started this year is just bringing it all together, ensuring that as a child comes through the doors of the Red Cross Children's Hospital, they receive all the care that they need, the right care. And I think the bigger vision is not just at Red Cross, is that once the training program has been set in place, that it can be extended across all health facilities, so that any child, whether it's a clinic or a district hospital that you're walking in, that if there's red flags to be identified, that the staff there know exactly what to do and when.
As someone who collects resources to help support the hospital, what areas do you still want to support? Maybe which areas are lacking? And also in terms of the funds, are you receiving the necessary funds? And also maybe what is just needed from the part of the hospital?
So from a resource point of view, what we had done was through the emergency unit, when we'd helped raise money for the new emergency unit, we had been asked to create a child protection space. I think it's awful that we have to say that in a children's hospital, that we need a special space for children who've experienced sexual abuse. But the staff clinically are brilliant, and so he's saying, but what can we do to support you more? And that's where the request came in for training, so that it's not just one element of the hospital that knows how to identify children with child protection needs. And so now extending it across the hospital. And I think resources, the project is, we have just started, we're year one of a 5-year project, and that we're hoping to grow it exponentially so that children receive the care that they need as soon as possible. It's an 8 million rand project, and we are very grateful to donors who have already contributed towards the project. So we're 50% there. So we've already raised over 4 million rand. So we're very, very grateful.
You're talking about extreme cases of abuse, and we are in Child Protection Week trying to raise awareness on safeguarding the children. What can you say to people, as people who are dealing with these cases? What can be done to, sort of mitigate that neglect, and also to reduce the violence, or even scrape it all together?
It's not an easy question to answer, because we're actually living in violent communities, and children are, it's almost like, we're saying that what happens in hospital is a microcosm of what we're seeing in the hospital, is a microcosm is what's happening in our society. I think our social workers and our clinicians are always saying, if you are suspicious of something, report it. If you suspect that your neighbor is hitting your child, or if there's abuse, report it. Go to the police station, go to your social workers. Or what happens at Red Cross is that there's neighbors and aunties and uncles and grannies that are actually bringing children to the emergency center. So if you are concerned, raise the alarm bell. Don't think it's not your business, because it is your business. Because as adults, it's almost like Ubuntu. We are responsible for our children.
Thank you so much. Chantal Cooper, CEO of Red Cross War Memorial Children's Hospital, talking to us about the rights enshrined in the Constitution for the children, which are articulated that protecting children is not just a basic value, but it is an obligation from all of us to make sure that we report any cases of child neglect, abuse, violence that is committed against children. We report it, and some of, as she has articulated, that some of the children that are brought in here are brought in by their relatives and some of the neighbors. So it is very important that people do raise an alarm and making sure that we safeguard our children as a society as a whole. From myself, Atule Joka, and my colleague Clinton Cerf, back to you, studio.